Hello friends, so in this video I'm going to discuss about Norma verticalis. So as you know there are different views of the skull. So this view which I am seeing from above is known as the Norma verticalis. So first of all, the shape of the skull when we see the skull from above is oval in shape. It is wider posterior as compared to the anterior part, and the bones that I can see here in this view is first is the frontal bone, the two parietal bone and a part of occipital bone. Then the sutures that I can see here is first the coronal suture, the sagittal suture and the lambdoid suture. Now, this coronal suture is the junction between the frontal bone and the two parietal bone. Then this is the sagittal suture, which is the junction between the two parietal bone, and this is the lambdoid suture, which is present between the parietal bone and the occipital bone. Okay, now there is one more suture that is known as the metopic suture, which is not visible, which is not present in all of the individuals. It is present only in 3 to 8% of individual. This metopic suture is shows the it represents the junction of the two halves of the frontal bone. This fuses by 6 years, so it is not present in all the individuals. It is present only in 3 to 8% of individuals. Okay, now there are some important terms that is related to this Norma verticalis. So first is the vertex. Vertex is the highest point on the sagittal suture. Then we have the vault. Vault means the arched roof of the skull is known as vault. Okay. Then this prominence which you can see on the parietal bone is known as the parietal eminence or parietal tuber. Then we have a foramen here on each side. This foramen is present on beside this sagittal suture. This is parietal foramen, and through this foramen passes the emissary vein. Then there is another term that is obelion. So obelion is the distance, it is present between the two parietal bones. So this part, the middle part, is known as on the sagittal suture is known as the obelion. Then another term is the temporal line. So here you can see in the lateral, if you see from above, you can see these are the two temporal lines. So this temporal line starts from the frontozygomatic suture. Here this suture is the frontozygomatic suture. This is the frontal process of the zygomatic bone, and this is the frontal bone, and this is the zygomatic process of the frontal bone. So here there is a suture which is known as frontozygomatic suture. So these temporal lines start from this frontozygomatic suture. It arches over the frontal bone, then it crosses the coronal suture. It reaches on the parietal bone. Anteriorly, there are two temporal lines. Posteriorly, when traced, the superior temporal line fades away and the inferior temporal line continues downward forwards, and it merges with the supramastoid crest, and then it merges with the zygomatic arch. So here you can see this is the zygomatic arch. So this is the supramastoid crest. This is the mastoid process. So just above this mastoid process, here we have a crest which is known as supramastoid crest. So this inferior temporal line, it arches forward and it merges with the supramastoid crest, and then it merges with the zygomatic arch. So this was about the temporal line. Now in this view there are very important points like